our NHS. My right honourable friend, the Health Secretary, is beginning to repair the damage of the last 14 years. In our first week in office, he commissioned an independent report into the state of our health service by Lord Darcy. Its conclusions were damning. While our NHS staff do a remarkable job, and we thank them for it, it is clear that in so many areas, we are moving in the wrong direction. 100,000 infants waited over 6 hours in A&E last year. 350,000 people are waiting a year for mental health support. Cancer deaths here higher than in other countries. It is simply unforgivable. In the spring, we will publish a 10-year plan for the NHS to deliver a shift from hospital to community, from analogue to digital, and from sickness to prevention. Today, we are announcing a down payment on that plan to enable the NHS to deliver 2% productivity growth next year. These reforms are vital, but we should be honest. The state of the NHS that we have inherited after, and I quote Lord Darcy, the most austere decade since the NHS was founded, means that reform must come alongside investments. So today, because of the difficult decisions that I have taken on tax, welfare and spending, I can announce that I am providing a £22.6 billion increase in the day-to-day health budget and a £3.1 billion increase in the capital budget over this year and next. This is the largest real terms growth in day-to-day NHS spending outside of COVID since 2010. Let me set out what this funding is delivering. Many NHS buildings have been left in a state of disrepair. So we will provide £1 billion of health capital investment next year to address the backlog of repairs and upgrades across our NHS. To increase capacity for tens of thousands more procedures next year, we will provide a further £1.5 billion for new beds in hospitals across our country, new capacity for over 1 million additional diagnostic tests, and new surgical hubs and diagnostic centres, so that people waiting for their treatment can get it as quickly as possible. My right honourable friend, the Health Secretary, will be setting out further details of his review into the new hospital programme in the coming weeks and publishing in the new year. But I can tell the House today that work will continue at pace to deliver those 7 hospitals affected by the RAC crisis, including West Suffolk Hospital in Bury St Edmunds and Leighton Hospital in Crewe. And finally, because of this record injection of funding, because of the thousands of additional beds that we have secured, and because of the reforms that we are delivering in our NHS, we can now begin to bring waiting lists down more quickly and move towards our target for waiting times to be no longer than 18 weeks. By delivering on our manifesto commitment for 40,000 extra hospital appointments a week, that is the difference that this Labour government is making. Madam Deputy Speaker, the choices I have made today are the right choices for our country. To restore stability to our public finances, to protect working people, to fix our NHS, and to rebuild Britain. That doesn't mean these choices are easy, but they are responsible. If the party opposite disagrees with the choices that I have made, then they must answer. What choices would they make? Would they again